مرحبا وأهلا بكم في برنامج داخل واشنطن. معكم مضيفكم روبرت ساتلوف. كان أهم إنجازات باراك أوباما، وكان أكبر هدف سياسي لحملة دونالد ترامب للبيت الأبيض، وهو واحد من أكثر القضايا المثيرة للانقسام في مضمار السياسة الأمريكية، والمقصود موضوع الرعاية الصحية. في بداية رئاسته واجه باراك أوباما اختياران: هل يجدر به إنفاق رأس ماله السياسي على برنامج لإيجاد فرص عمل ستساعد الأمريكيين الذين يعانون من الركود، أم ينفق رأس ماله السياسي على وضع برنامج قومي للتأمين الصحي سيساعد 40 مليون أمريكي دون رعاية صحية؟ راهن أوباما على الرعاية الصحية، ودون صوت جمهوري واحد غير ملامح نظامنا الطبي القومي تغييرا بالغا. طوال 8 أعوام وعد الجمهوريون بإلغاء خطة أوباما متى سنحت لهم الفرصة، وأخيرا منحهم انتخاب دونالد ترامب إضافة إلى السيطرة الجمهورية على الكونغرس الفرصة، ولكن بعد شهور من الجهد فشلوا. ما معنى كل هذا بالنسبة للرعاية الصحية في أمريكا اليوم وفي المستقبل؟ لمناقشة هذا السؤال المحوري يسرني أن أرحب بأستاذ ليتن كو، مدير مركز بحوث السياسات الصحية في جامعة جورج واشنطن في واشنطن. Welcome back to Dakhel Washington. Today we're talking about one of the most important and controversial issues in American politics. It's been at the heart of American political debate for decades. Healthcare. How do we pay for it? How do we deliver it? And how are we doing in America? And my guest today knows more about this than just about anyone, Professor Leighton Koo. Welcome to our show.
Thank you for having me.
So let's first begin with a term that Americans have gotten used to in the last number of years, Obamacare. What is it all about? How did it change our health insurance system?
Sure. So Obamacare, usually people refer to it's a law that was passed in 2010 after much debate. Part of the concern is the United States has a fragmented system of health insurance coverage. For many years, roughly speaking, 50 million Americans were uninsured, and the number of uninsured people who, because they were uninsured, couldn't get access to affordable health care was creeping up. At the time that President Obama was elected in 2008, he made a point that he wanted to try to expand health insurance coverage in the U.S. to get maybe not all the way to universal health insurance in which everyone would be covered, but that we could make a big difference. This turned into a fairly big partisan fight between the Democrats, and President Obama was a Democrat. Democrats had control of both houses of Congress at the time, and the Republicans, who at that point were a minority. The Obamacare law was passed in 2010, and it made a number of changes to particularly try to increase the number of people who had health insurance coverage, and it's been pretty successful in doing that. Basically, the studies show that since that time, something on the order of 20 million more people have gained health insurance coverage. So it was a success in those goals, but it was partisan from the beginning. So when it passed with no support at all from Republicans, and so Republicans since that time have been saying pretty consistently we need to repeal Obamacare. They felt that it was an expansion of government, that it was doing things the government was not supposed to be doing, that it cost too much money. So it became a unifying cry for Republicans. And of course, at this point, Republicans have, there's President Trump, who's a Republican, in the White House, and they have majorities in both houses of Congress. So this time people thought they could make a big difference. So what Obamacare did was it reformed health insurance coverage to expand health insurance and change the rules by which private health insurance worked. It expanded the big public health insurance program for poor people, the Medicaid program, and it created something new that has probably been the most controversial part, sometimes called the Obamacare exchanges. And in the exchanges, this was a new way that people could buy and shop for health insurance, private health insurance, through government-sponsored websites. People who had moderate and low incomes would get some assistance from the government. They get tax credits to help them pay for that. There have been some problems with the exchange recently, which led to sort of was what was leading to some of the big fights.
Okay, so let's back up a bit, because you've given, I think, an excellent summary of Obamacare issues in the last half dozen years, and I'm sure many of our viewers are wondering, wait a minute, there's no national health care in America. Is that right? How could that be? So our system is really very different than many systems in many other countries. Is that correct?
That's true. I mean, many other countries developed national health systems or something that approximated a national health system. These were changes that occurred in most developed countries beginning, say, from the 30s up and through the 90s. This never took place in the US. The biggest single change that happened in health insurance in the US was in the mid-60s, when the Medicare, which is the health insurance, the government health insurance program for senior citizens, was started, in Medicaid, the health insurance program for poor people started. So those began in the mid-60s, and it's been big fights ever since then at various points. And so though Obamacare did not create a massive change, it was designed to sort of try to build on the system, because this system is fragmented. So people in the US, the most common form of health insurance is people have health insurance through their jobs. Some people, senior citizens, typically have the Medicare program, which is a government-funded program to buy health insurance. Poor people, if they don't have insurance through their jobs or such, would getting health insurance through the Medicaid program. And then there was something called individual health insurance, so people who aren't getting health insurance through their job could buy health insurance from insurance companies on their own. And that was particularly the least stable part of the market. Health insurance tended to be very expensive. People found they couldn't afford the insurance. They would sign up for insurance for a couple of months and then stop. So this was what Obamacare was designed to try to fix, those particular problems. And so the expansion of Medicaid was designed to help poor people who really couldn't afford much at all, and then to create a more affordable way to get private individual health insurance for people, and also to help small businesses, which often would have problems paying for health insurance for their workers. So those were the problems, the main problems that the Affordable Care Act was trying to resolve.
And the main Republican critique you suggested is part of a larger critique about the growth of government. Government too big, government taking over people's lives, government should not, people should not be required to get health insurance. A general big government critique, is that correct?
Yes, that's right, and I guess it's fair. I forgot to mention, you pointed out, one of the particularly large critiques was included in Obamacare was a requirement that most Americans have some sort of health insurance, and if they didn't have health insurance, they were going to pay a tax penalty. They'd have to pay several hundred to possibly $1,000 or $2,000 in additional federal taxes. So that was something that telling people you have to have health insurance or you're going to get a fine from the government really stuck in people's throats as something that was, unwanted government intrusion And in addition, there was this broader notion that government had gone too far, both in terms of paying for these things, so the government was doing things that people should be doing on their own, as well as then, in particular, that requirement that people had to have health insurance coverage.
And is the basic idea that this could only have come about as a package? You couldn't pay for the advantages without having people be required to have insurance?
Well, so this is part of the tricky part that gets somewhat into some of the big fights that happened here over the past several months, was how much was this packaged together? What happened was people felt if you have some of these expansions of health insurance coverage and you change the rules and you encourage people to buy health insurance individually, that if you don't have some sort of a requirement to buy health insurance, then only the sick people will buy health insurance and people who are relatively healthy will do without. And this makes the price of health insurance that much more expensive because only sick people are using it. That in addition, they may drop in and out. So the insurance companies in particular said, if you don't have some sort of a mandate, if you don't have some way to make sure that everyone gets in so we spread the cost equitably across everybody, then it's not going to work very well. So that was one of the big fights recently was over that. That was the reason why it was packaged together. I will say that sort of creating the Obamacare package was not easy. It took a year of debate and consideration in Congress when it passed in 2010. You may remember President Obama was elected in 2008. Came into office in 2009. Basically, that whole first year involved sort of negotiations with Congress, trying to figure out how are we going to do this, and they included Democrats and Republicans in those negotiations, though in the end only Democrats supported it.
So now that we have a few years of experience, people on different sides of the aisle look at the same experience, look at the same numbers, look at the same story and see different things. Some see success, some see failure. Right. Lay that out for us, please.
Well, part of this is because most of the people continued to have health insurance through their job, or in many cases, if you were a senior citizen, you had it from Medicare, so things didn't change for most people. So some people were affected. So as I said, maybe 20 million people gained health insurance, but that's still, given a country of more than 300 million people, that's a small number. So for most of the others, they didn't have any direct experience with it, and they were being told fairly consistently, Republicans were saying, oh God, it's awful, it's a failure, it's horrible, it's collapsing, it's doing terrible things. Democrats in the meanwhile were saying, no, 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 it's really working well. What happened was, to a great extent, it became a test of how you felt politically, and it wasn't so much about the reality of things as compared to people's political views. And I think that's pretty consistent. I think after it passed, Democrats thought it's going to be such a great program, the American public will love it. In a couple of years, we're going to have 80–90% of the public will support it. Republicans thought, oh, this is such a horrible idea. When they bring it in, before too long, 80–90% of the people will hate it. Well, it actually didn't stay that way. It pretty much, until recently, public views stayed about the same. There have been some problems with Obamacare. At this point, every single county in the country has a private health insurance that will offer health insurance through the exchanges. But there have been some difficulties and things that need fixing around the edges as opposed to big changes.
We're going to come back in just a minute to discuss those areas that need to be fixed and the long-term direction of American healthcare in just a moment. Our guest again today is Dr. Leighton Koo. Dr. Koo, one of America's leading experts on healthcare delivery, is professor and director of the Center for Health Policy Research at George Washington University's School of Public Health. As a health policy researcher, a public policy analyst, and an advocate, Dr. Koo has built his career around the effort to understand and improve access to affordable health care for vulnerable populations. He has been associated with George Washington since the early 1990s. In addition, he has also served as a senior fellow at the Washington-based Center on Budget and Policy Priorities, which focuses on improving policies for low and moderate income Americans, as principal researcher at the Urban Institute, and as analyst for the federal government's Women, Infants, and Children Nutrition Program. So I want to ask you about how the discussion we're having about health insurance and health delivery, how that connects to the fact that we have a federal system in our country. And so we have 50 individual states who also play a role in some of these decisions and implementation of programs, not just the single federal government. How does that relationship work out?
One of the big ongoing struggles in American public policy has been what's the right level, who should control things. So you're right, we have the federal government, and then for certain areas we have the state governments. And then of course finally the question, gee, maybe the local government should be in control, or maybe no government at all and it should all be done privately and individually. And so these are the grand fights of American government. What happens in the current American system is for senior citizens, the Medicare program, which has around 40 million people, mostly senior citizens enrolled, is a federal program. So every American who's over a certain age is able to participate in Medicare. For poor people, we use the Medicaid program, which is a funny sort of joint federal-state program. The federal government pays the majority of the money, but states actually control it. And so states differ in how much they've expanded things. One of the things that happened that was not expected in Obamacare was there was an expansion of Medicaid to go to just above the poverty line that was supposed to apply across the whole country. There was a lawsuit that was brought, and the Supreme Court of the United States in 2012 said, no, you can't force the states to adopt the Medicaid expansion if they don't want to. So at this point, 32 states, including the District of Columbia, have adopted a Medicaid expansion. 19 states have not. So it's not as though in those 19 states they don't have a Medicaid program at all, but their Medicaid programs are much smaller. The eligibility levels are much lower. Few people are able to participate. So one of the things that's happened that we could see very clearly is that the number of people who gained health insurance grew a lot in the states that expanded Medicaid, has not changed very much in the states that did not. So we've sort of created bigger gaps. And so that's part of this struggle between the role of the federal government and the role of the states. And then again, at some point, what role should the government, whether state or federal, have versus leaving it in individuals and private hands?
So we began the show with a discussion of Democrats and Republicans fighting over changes in our system, Obamacare. Republicans had a chance to undo Obamacare, couldn't muster the votes this past summer. Is this issue going away, or do you expect to see this issue bubble up again? Will we have another national debate about this before long?
Well, we're already having a sort of smaller debate. So you're right, the Republicans earlier this year were saying we really want to sort of repeal and replace Obamacare, really sweeping changes to the law. That did not pass in Congress. They just didn't have quite enough votes to pass it. At this point, the considerations are there things that we can do to make minor changes in the system to help sort of make sure that those Obamacare exchanges stay a little more stable. There are some hearings that have gone on just recently in Congress that hopefully before the end of September will result in some laws to try to make some small fixes. I think this will come again next year. I think some of these big fights will occur. Part of it is the Republican majority in the Senate just failed by one vote. So there's just one senator who changes their mind. Senator McCain, who cast the final deciding vote, we know he has terminal cancer. So at some point he will die. hopefully not soon. So what will happen when he's replaced? The 2018 elections are coming in about a year. If the votes turn a little bit differently, so there are more Republicans and more Democrats, that could swing back again. What I don't know is will the Republicans try to push so hard between now and November 2018, which is when the next set of elections are going to be, to repeal and replace again. They spent a lot of energy, felt very frustrated, but it's still a major cause to a large number of them and to the president. So we're still in sort of a lull, but chances are a hurricane will be coming again sometime soon.
Well, an apt metaphor given recent weather. It sounds like we're going to be dealing with this issue for quite a long time to come. Thank you so much, Professor, for being with us on Dakhel Washington today.
It was my pleasure. Thank you.
بهذا نصل إلى نهاية هذه الحلقة من برنامج داخل واشنطن. إذا كانت لديكم أي استفسارات أو تعليقات حول هذه الحلقة وخاصة حول وضع الرعاية الصحية في بلدكم، أرجو أن تراسلوني مباشرة على عنوان البريد الإلكتروني التالي insidewashington@alhura.com. معكم روبرت ساتلوف. شكرا لكم وإلى اللقاء.